clearly unwell. We don't know yet what the problem is. We know that she's got pain in her chest. And the first responders are trying to sort out what's going on there. They're talking around there, working out what seems to be the problem.
Can I be a response report?
I have more specialised here, and they're using that. Try and work out what's happening. See how your heart's beating. We don't know yet what's for it. Paramedics are starting to use the equipment there. They're checking oxygen, they're checking blood pressure, and they're putting wires on her lip so that they can get an electrical tracing of her heart and see whether she's had a heart attack. And there's obviously a limit to how much they can do on the stop, and sooner or later they're going to need to take her to someone else so that they can have a so the ambulance paramedics here with specialised equipment, special trolley that goes up and down. Very important that somebody's not got a number of circulation. You see that they've got a tablet EC, which we'll hear more about later on. Paramedics are putting on blood, they're getting the equipment ready. We can see how the players put the lead on and that's allowing him to get a of the electrical activity of that car. You see that it's really seriously working. That's putting on the scariest thing to have all this going on all around her. Really serious. You have a heart attack where your heart doesn't stop beating, but when you do, what's happening? You take a good answer and it's all that part is not going to be. I know about that. Regular heart. The artery that takes blood to the muscle of the heart itself, and that's the kind of thing. We may have gone wrong in everything. The paramedics
Can you hear me at the back? Can anyone wave at the back to say if you can hear me? Okay, good. Lots and lots of waving. Okay, good. So you can see here we've got an ambulance kit here. Our real-life ambulance crew have brought Emma in. She's looking pretty unwell, pretty pale and sweaty and quite scared. It's all a bit frightening for her. She's not really sure what's happening to her. You know, we've had a discussion outside about what we think might be happening, but actually to her, she's thinking I've got the worst pain I've ever had in my chest. am I going to die, what's it mean, where am I going, what's going to happen. And you can see the ambulance crew here, they've got all sorts of wires and leads on her to try and find out the answer to that question. So they'll be putting in a drip into the back of her hand so they can give her fluid and painkillers and medications to help her feel better. And the monitor that Chris there has at the back is giving them a lot of information. Now it probably looks just like squiggly lines, but actually that's a form of code for the ambulance crew and for the doctors later on to help us work out whether it is actually a heart attack that's causing the pain. So if we hand over to the ambulance crew, they'll be able to tell you a little bit more about what they're doing.
Okay, here we have Emma. She's 58 years old. We were called to her by our lovely first responders, thank you very much, lovely first responders who have told her that she's suffering from pains down her left hand. From that assessment, we've applied the monitor to her, and we can clearly see that there is a problem with her heart. It is quite worrying. She's also told us that her father has died of a heart attack, and her sister has underwent some cardiac history, which means that she's going to probably receive the same treatment, which is angioplasty. So what we're going to have to do is, unfortunately, we have to rush her to the closest cardiac centre to get some surgery done on her heart.
Okay. So during her trip in the ambulance, they've started doing some investigations to try and find out what's going on, but also started some treatment to try and make her feel better. And what we'll do, if we all slowly move next door, we'll see what happens when she gets to the hospital and meets the cardiologist.
So I'd like to suggest that there are a lot of people here. First of all, can I get you all to move back?